So I think there's a lot of interesting developments in PSMA research. I think we're understanding more and more how PSMA imaging can be used in current modern day treatment schemes. We have a better feeling for how PSMA fits into staging and managing patients with biochemical recurrences, as well as patients with low burden metastatic disease, and the role of PSMA imaging in selecting patients for metastasis-directed therapy. So I think the use of PSMA will expand both in terms of its diagnostics as well as its therapeutics. More and more we're going to see that PSMA imaging is going to be used for monitoring patients. Right now it's largely focused on initial staging, identifying sites of recurrence in patients who have a biochemical recurrence, and determining eligibility for PSMA-based radionuclide therapy. But more and more data are coming out that PSMA imaging can be very effective in monitoring response to treatment and gaining insight into disease heterogeneity that may not be captured by conventional imaging. So in terms of monitoring, we would want to get baseline scans prior to a given treatment, and then a follow-up scan after a finite period of time to assess response to treatment. And with PSMA imaging, one can get a sense of the disease heterogeneity. So what that means is that when a patient has multiple sites of disease, that there can be differential responses to treatment that are attributed to the different underlying biology of individual metastatic lesions. As a consequence, there can be an approach that's taken where additional therapy is added on top of a given systemic therapy to manage individual site or sites that may not be responding to treatment. So as an example, if a patient has 5 metastases, gets treatment that effectively reduces the 4 out of 5 of these metastases, but one of them is progressing, that's not something that we would capture necessarily on conventional imaging, especially if it's bone involvement. And we could see that on a PSMA scan and then direct therapy to that non-responding metastasis.